Hey everyone, today we're going to focus on a pain point that many of us encounter, and that is stress-related headaches. The ones that seem to target the brow and the temple region, and that can wrap around to the base of the skull. You know, we all get them from time to time, some of us more than others. So let's discuss some immediate relief strategies that you can start implementing today. And these are some key takeaways that hopefully can help you to reduce some of those headaches. One of the most common culprits behind these types of headaches is related to the jaw. And more specifically, it's the muscles of mastication. So that's really just a fancy way of saying the muscles that are involved in chewing. Now, some of these muscles are hard to find and you have to palpate them deep kind of into the back of the mouth. So we're not going to go into those today, but I'm going to show you two of them that are very easy to palpate with just a brief little lesson here. So if you have a history of TMJ issues or you grind or clench your teeth at night, then you'll want to try these out. Chronic strain to these muscles that cause the biting down or the clenching can cause myofascial pain syndrome, which can lead to referral into the temple or the brow like we talked about before. Now let's first discuss how to check and find these muscles. The first muscle is the masseter muscle, which is a large jaw muscle below the ear. So take two fingers, I prefer the middle and the ring finger, clench your jaw, and you're gonna feel the muscle belly pop out under your fingers. The second muscle is the temporalis muscle. So the way to feel this is you're gonna go all the way up to your temples. You're gonna go to what's the bony area here, just below your temples, called the zygomatic arch. You're gonna gently go above the zygomatic arch with the same two fingers, and you're gonna clench down, and you're gonna feel the muscle belly push out underneath your fingertips. For both of these muscles, the way you can get relief when you have myofascial pain is you can hold pressure when you palpate and locate the muscle belly, and you're slowly gonna open up your jaw as you apply the pressure. So 2 fingers of pressure, open up, let go of the pressure as you close, and do this 2 or 3 times. What you can do is you can move around. You're gonna find a couple areas that are pretty tender, and what you're gonna do is just apply the pressure as you open. So what's happening here is you're lengthening the muscle as you apply the pressure in hopes to relieve some of the tension built up in that muscle. Now, other than just pain local to the area, another way that you know that you're in the right spot is it may cause those same referral symptoms back to the brow and the temples. You might even notice it to the back of your head. So sometimes just palpating it without opening your jaw will recreate those symptoms, and that's how you know you're 100% on the right spot. So the second area that is so important is what's called the suboccipital region of the neck. So this is the area that is right below the skull, and there's a little divot in the back of your neck, and this is so important because the top 2 cervical vertebrae are there, the atlas and the axis, and they're more important than any other area. They are highly involved in what's called proprioception, some of the muscles that are related to that area, and these can cause referral up to the temples in the brow region as well. And sometimes people will notice that if they put a little pressure there, if they're under high stress, they have deadlines at work, whatever it may be, and that causes that recreation of pain and the headache. So the way you can locate this is take either 2 fingers or 2 thumbs, and what you can do is take those thumbs, slide down the back of the skull. You're gonna find a divot right off the back of the skull, and what you can do when you go down there as you can kind of just poke around in that area, and you're gonna feel a couple tender spots. And now when you hold those tender spots, you're gonna tilt your head down, or you can rotate away from the side that you're holding the pressure on if you wanna do one at a time. And you might notice the recreation of the symptoms of the temple headache or the brow headache, or it can even shoot up the back of the head. If you're doing this for a couple days and you find the painful spot and you still can't get relief in that area, you may want to consider to see a chiropractor. I've seen a ton of patients that have this, and as soon as these symptoms show up, they get adjusted and the headache goes away. That's because there's a little bit of a shift or deviation in the atlas or the axis, and typically if you find the right spot, it will clear out that headache right away, and you can literally see them walk out in a lot better state than when they walked into the office. The other thing you can do is also engage in gentle neck stretches when this area is irritated. Oftentimes there's a lot of strain here. The underlying reason being is that we're down on our phones looking down, or we're typing on a laptop which our head is tilted down, and that's causing attention to those muscles. So I'll link up here to a list of just gentle daily neck exercises and stretches that you can do at home or at your desk while you're in the middle of work, so you don't get a lot of tension built up in there. Now, the last thing not to overlook is your vision. Constant squinting can cause straining and trigger these types of headaches. So ensure your prescription for your glasses or your contacts are up to date, and get your eyes checked regularly by your optometrist. Now, if nothing else is working with these stretches, or you see a chiropractor, then definitely check this box off, because sometimes that can be the underlying cause as well. So these types of headaches are a burden to many, but they really shouldn't be, because there's a lot of at-home strategies that you can do to start targeting those points that are causing them and cause the intensity of those headaches and frequency to go down.